A common question that we're asked is how to really tell if your prostate is enlarged. It's very common for men's prostates to grow over time, and therefore sometimes the symptoms will be in a spectrum from very mild symptoms that start kind of as a bother to very severe symptoms, with the worst of those being not being able to pass your urine at all. I think a lot of people fear that particular symptom, but there's a pretty big spectrum between the two things. The symptoms that are most common are the things that you would expect. And that is that there would be potentially a weak urinary stream. So you find that when you're going to the bathroom, it just doesn't come out as quickly as it used to. Also, the sensation of possibly not emptying your bladder completely, which has to do with the fact that the bladder is squeezing against the obstruction from the prostate and may not empty completely. The other thing that some men will experience is frequent urination and sometimes nighttime urination. And they essentially come from the same source, and that is that the bladder potentially not emptying completely because it's obstructed partially from the prostate. The other thing to keep in mind is that the bladder's response to being blocked is to try to squeeze harder. And when it does that, unfortunately, that will give you sometimes a strong sensation of the urge to void. And will also potentially injure the bladder over time because of the fact that it's squeezing against an obstruction.